Judith, welcome to #Mental Health Day.
Thank you for having me.
The first thing I want to ask you is, could you tell us a little bit about yourself and your journey to this point?
I'm someone who researches the science of happiness, and I treat patients as a therapist, helping people to live happier lives. And personally, I went through a period where I didn't even know that I was depressed. I had something called high functioning depression, hidden depression. So essentially, I was pathologically productive, doing all these great things on the outside, but no one knew that I was struggling. And I was struggling with a lack of joy, something called anhedonia. So I set out to research, well, why is it that some people, when they're experiencing depression, they don't break down? They do the opposite. They can't sit still. They keep going. They push through their pain. And how can we help people like myself to access joy again? Because joy is not only important for healing yourself, but it's also important for healing communities and for living a better life in terms of everyone around you.
So you found out that you had this, and then what did you do? I mean, how has it become a kind of profession? I mean, you're writing, you are out there in the world in a major way. Tell me about the evolution of how you've got to the position you're in now.
Well, I had to research this because there was no name for it. And so I created the first study in the world based on high functioning depression, enrolled patients into this clinical study, and published the first and only peer-reviewed journal article on high functioning depression based on my clinical research. And what I found was that a lot of people deal with trauma and pain and negative past experiences by working through them, by pushing through pain, by taking on new projects, by not actually taking the time to process their trauma. When they sit still, they feel empty. When they're not busy, they feel restless. And so rather than doing that, the book and my work encourages people to validate these negative experiences, not run from them, process their pain, try and heal from their pain so that they make better decisions that not only impact their own happiness, but impacts the people around them.
Incredible. I mean, I want to ask you a question, but I want to talk about the book right now because it's. Can you tell me about it?
So my book talks about, why is it that people end up this way? What are the risk factors? There's something called anhedonia, which is a lack of joy. And joy is something that's built into our DNA. It's our birthright as human beings. But when we forget how to access that joy, what ends up happening is that we don't realize how this lack of joy ends up spreading to people around us. So, you look at leaders who are lacking joy. You walk into their organizations and everyone's unhappy. People are grumpy. But if you look at leaders who are joyful, who actually prioritize their mental health and look at the people around them, everyone around them is happy. So it's contagious, not in the way that a virus is contagious, but in the way that certain cultures and philosophies are contagious. So if we can focus on cultivating joy within ourselves and, processing our mental health pain in a healthy way, then it not just impacts us, it impacts those around us.
And so the book is going to delve into finding joy.
Essentially, yes. Understanding how we ended up in this place, understand how to process our trauma and our pain, and how to use evidence-based tools to access joy in our everyday lives.
When I look out into the world, as you know, I've been on the road for 26 years, 160 or so countries, and been in some fairly difficult situations. And we've had those things happen in our homes as well, or in schools and in communities. When you look at what's going on now at the moment, so this year, more wars raging than ever since the Second World War. 2 billion people living in areas of conflict. Things happening in our society which are extraordinary and are dividing us. So I think about my own mental health, and it's a struggle to kind of go, okay, I can make sense of this world that I live in. And I look at my children and I think, okay, how are they going to cope? And how can I have that conversation with them? You must be thinking about this a lot. What's your assessment of what's happening? And how do you think we can get support when this is going on in the world?
It's really important to, number one, acknowledge it's happening instead of just getting numb to it. What happens is that when our brains see all this chaos and we're accustomed to seeing violence and we're accustomed to this bad news, it desensitizes us. Typically, when you see all these things happening in the world, a part of your brain, the amygdala, gets excited, which tells the front of your brain to start, feeling fear or emotions. But over time, if our brains just get so accustomed to all of this trauma, we feel numb, we feel flat. And then we go through life not caring about our fellow man, our fellow human. So it's important to not just walk through it and say, this is just the new normal. Let's challenge it. Let's take the time to acknowledge that this is painful, that this is not how the world should be, and start to tap into ways to connect to others intentionally. And that looks like practicing acts of kindness, reminding yourself to be empathic. Even if someone doesn't agree with your point of view, remind yourself that they're human too. All of these practices allows us to not get numb to this pain, but to tap into grounding ourselves in the human experience. Without practicing this type of empathy, civilizations fall apart. If we don't connect to the next human, whether or not we like them, whether or not we agree with them or not, our civilizations fall apart. The world will continue to fall into chaos.
I want to ask you, you're writing, you're speaking, you're going around the world. I mean, you're doing all you can to inform, inspire, and engage people, which is amazing. If you could speak to lots of people, which you're doing anyway, I mean, what do you think is a key message of all of your learnings and understanding of what's happening to ourselves because of what's going on in society? What's the most important message that you want to get to people?
There's only one you, and there will only ever be one you. So take the time to understand the science of your happiness. If you're feeling fearful, if you're feeling anxious, try to understand that. It's important because we know that when we're driven by fear, anxiety, and we don't take care of our mental health, and we don't learn how to regulate our emotions and to ground ourselves into what really matters, that it spreads. What happens is that you end up snapping at your neighbor. You end up yelling at your boss. You end up not caring about, when something bad happens to a fellow human. So really taking care of your mental health and acknowledging your experiences and then doing something about it is so important. It's not just about you ultimately. You're a unit in this grand scheme of this world, and you matter.
Finally, Judith, what I'd like to ask you is for somebody who's out there struggling with what's happening in the world, in a difficult place with their own mental health, what resources would you recommend? How can we follow you? But what else would you say people should do if they're in a difficult place?
Don't do it alone. Loneliness is a real problem these days in terms of mental health. We have access to connecting with people using technology, but what we're learning is that loneliness is problematic. It makes us desensitized. It makes our physical health worse. And it doesn't do anything to solve this problem that's happening where people are fearful, they're not connecting, so don't do this alone. And then follow me on my websites, on my platforms at Dr. Judith Joseph. My book has a lot of tools that are evidence-based. Try to understand ways to support you because, again, there's only one you. So figure out where you're losing your joy so you can learn how to add that joy back into those areas of your life.
But definitely don't be alone. Definitely don't be silent. Speak out. Talk with your friends and your families. Well, thank you so much for speaking to us. And it's a real honor to tell your story for #Mental Health Day. Judith, good luck with everything.
Thank you for having me.